If you're brand new to contacts and you want to know how to stick this tiny little piece of plastic in your eye, then keep watching, because in this video, I'm going to show you how to do it safely, correctly, and without hurting yourself. Let's get started. Hi everyone, I'm Dr. Griffin Durius, and my wife and I own Sight to See Eye Care and Eyewear in Geneva, Illinois. If you're new to the channel, consider subscribing to learn about all things eye related, and drop a comment on what you want to see in the next video. Before we get started, please make sure you've gone to an optometrist or an ophthalmologist and gotten a prescription for contacts before you try to put anything in your eye. I know you could get contacts online at various websites, but all contacts are not created equal. If you're a first-time wearer, your eye doctor office where you get your exam will also do an insertion and removal class where they'll sit down with you and teach you how to put the contact in and take it out in person. That being said, keep watching for step-by-step directions on how to put contacts in your eyes. Step 1. Before even handling your contacts, you need to wash your hands. You don't want bacteria or other organisms getting on the lens and then sitting on your eyes all day. Next, dry your hands with a lint-free towel to avoid getting any debris on your lenses. Clean hands free of dirt and grime are key to preventing eye infections. Next, you're going to want to check your contact prescriptions. A lot of people actually have different prescriptions between the two eyes, and you don't want to get them mixed up. At Sight to See Eye Care and Eyewear, we make it easy for our patients by marking their contacts with a sticker, so check to see if your eye doctor did something similar. It's always best to create a routine, and starting with the same eye helps to avoid mix-ups later on down the road. I usually recommend starting with your right eye first. Starting with your left eye is fine, just make sure you do that every time. Most contacts will come in a little package called a blister pack. To open it, find the part on the bottom that comes up easily and then just peel it open. The contact lens will be sitting in the solution and might be hard to see, but trust me, it's in there. Take your clean pointer finger and scoop that bad boy out. It's really important that you never try to handle or grab your contact lens with fingernails because that can damage or even rip the lens. Make sure you're using the padding of your finger. Especially for beginners, I usually recommend cutting your nails first. After that, you're going to take the contact lens and you're going to set it on the padding of your dominant hand pointer finger. Once it's stable, inspect the lens for two things. The first is to see if there's any defects or rips in the lens, and if there is, throw that lens out and start a new one. The other is to see if the lens is inside out. Checking to see if the lens is inside out could be tricky, but there's a couple of ways to do it. One of the techniques is to place the lens on your finger, and when looking at it, it should look like a bowl. If the edges flare out and it looks like a UFO instead, then it's probably inside out. The other technique is something we call the taco test. You take the lens and you gently fold it in between your fingers. If the edges fold in like a taco, then it's the right way, but if the edges flare out, then it's most likely inside out. Now, if you did both of those and you checked and you feel like the lens is the right way, when you put it in your eye, if it hurts and you immediately feel pain, go ahead and take it, flip it the other way and see if that helps. Now that you've gotten done checking the lens, it's time to put it on your eye. This is where most people have issues, and the main reason is not getting enough control of your eyelids and being able to stop your blinking reflex. I'm going to show you how I do it and how I get a good grip on my eyelids. I always start by looking down first because that gives me more area of my eyelid to work with. I'll take my non-dominant hand, I'll reach over, grab as close to my eyelashes on my top lid as possible, and I'll pull up and pin that eyelid against the bone. Next, I'll take my dominant hand with my contact lens on my pointer finger. Using my middle and ring finger, I'll grab as close to the lower eyelashes as possible, and I'll pull that eyelid down, pinning that against the bone. By using this technique, you not only physically prevent your eye from being able to blink, but you also open up your eye as wide as possible to give you the best chance and most room to put that contact in. Once you've gotten a good grip on your eyelid, take your pointer finger and the lens and gently place it directly onto the front part of your eye. If you pull your finger away and the contact stays on your finger and not your eye, then that could mean your finger and the contact was too wet. Dry off your finger on a clean part of your hand or a lint-free towel and just try again. When that contact is on your eye, a lot of people immediately let go and blink hard, which knocks the contact out of place. If it does fall out and falls onto the sink or counter, that's okay. Just pick it up, rinse it off with solution and rub it, and then start all over again. Take your time. Think of that contact lens as a mini little shield for the front of your eye. You can touch it, you can pat it, and get out all the air bubbles and it won't hurt. Now that the contact is sitting on your eye and you've gotten out as much air as you can from under it, slowly close your eyes. With your eyes closed, slowly move your eyes side to side and in a circle to firmly seat that contact on the front. Oh, and by the way, contact cannot get lost behind your eye. That's a myth, don't worry. Now I know that was a lot, so let's go over it again. Look down, and with your non-dominant hand, reach over, grab as close to your eyelashes, and pull up and pin that eyelid. Then look up, with your dominant hand, grab as close to your eyelashes, pull down and pin that eyelid, look straight ahead, and slowly and gently put that contact lens on. Go ahead and pat the air bubbles out, and slowly close your eyelid. Now I don't want you to be discouraged if it takes you a couple of times to get the contact lens in. Poking your eye on purpose and putting a piece of plastic in the eye is not natural and it's not easy, but it does get easier with time. Also, depending on your prescription, your vision might not be clear as soon as you put the contact lens in. Those of you with an astigmatism may need to give the contact lens a few minutes to settle before things clear up. These lenses have a little mark on there for eye doctors to make sure they're fitting correctly, so don't throw it away thinking it's a rip if you see it. They're weighted on the bottom, so give gravity a few minutes to rotate it to the right direction. And that's it. You're halfway done. The next step is getting the contact lens on the other eye. Some people will switch it up and use their non-dominant hand to hold the contact lens, but if you're as uncoordinated as I am with your left hand, you just keep it the same like I do. I'll still hold the contact lens on my right hand, use my left hand to hold the upper eyelid, and right hand to bring down the lower eyelid. Thanks for watching. Let me know in the comments down below if you found this video helpful and were able to get the contact in, or if you do something differently to get yours in. Next up, taking the contacts out. I'll see you next time, and don't forget to subscribe and see the difference with Sight to See eye care and eyewear.